I have a 10-month-old, and my husband and I are in the process of attempting to sleep train him. I've done quite a bit of research when it comes to different methods of sleep training, but unfortunately, there's just no consensus when it comes to sleep training an infant. Additionally, there's information out there that states that the way that you sleep train your infant can have a lasting effect on their lives, their psyches, and their sleep habits into adulthood. I have sleep problems, and I definitely don't blame that on my parents, but I don't want my son to have sleep problems and be the cause of it. There is a lot of controversy surrounding sleep training for infants. There have been many studies done. So-called experts claim that they have the best methods available. The purpose of this speech is to inform on 3 of the many methods of sleep training. The 3 methods that I have chosen to review are the Shush-Pat method, the Extinction method, and the Ferber method. The first method that I've chosen to review is the Shush-Pat method. According to todaysparent.com, in an article published in March of 2020, Claire Gagne, the author, states that the Shush-Pat method is a sleep training method in which the caregiver lays the child down in their bed and plays white noise via a white noise machine or shushing via their mouths, and firmly pats or rubs the child's belly or back until they fall asleep. She states that this method can be used for children under 6 months of age, but apparently for children older than 6 months of age, it can be ineffective. She warns that they have formed attachment to caregivers by 6 months of age, and so being in the room but not picking them up can frustrate them. She states that with this method of sleep training, the job of the caregiver is to provide reassurance and attempt to help calm the child, and the job of the child is to fall asleep. Once the child is asleep after shushing and patting, the caregiver is to exit the room, but re-enter if they awaken and start crying, to begin shushing and patting for comfort again. Another method of sleep training is called the Extinction method. This is quite possibly the most controversial method of sleep training. It includes performing a nighttime wind down routine, making sure all needs are met, such as being fed, clean, and in a safe space, lying the child down in bed and leaving the room, allowing them to comfort themselves. This method is also known as Cry It Out. Use of the Cry It Out method or Extinction method has waned in recent years. Telling people that you allow your infant to cry it out can be quite controversial in a world where attachment parenting has become the norm. In an article published by Parents.com written by Catherine Lagasummarino in July of 2020, in which she interviews Craig Canapari, MD, an associate professor of pediatrics and the director of the sleep medicine program at the Yale School of Medicine, Dr. Canapari states that detractors of the Extinction method have used research conducted on children neglected in orphanages in which crying babies were rarely picked up to make their arguments against this method of sleep training. He states that the Extinction sleep training method is a very set sort of circumstances in which you're ignoring your child's distress, but for a set period of time in a well-defined arena. He thinks that it's perfectly fine. Further down in the article, Dr. Sanjay Kansagara, the director of Pediatric Neurology Sleep Medicine program at Duke University, says that while rigorous studies have shown that there is evidence of short-term benefits to both mother and child using the Extinction sleep training method, and that there is no evidence of long-term risk to children's health. But he does warn that it should be used in healthy children only, and for children with health conditions. Dr. Kansagara states that it is always best to speak with your pediatrician. The final method of sleep training I've chosen to research is the Ferber method of sleep training. Um, some people call the Ferber method the graduated extinction method. It is thought that the Ferber method is a bit gentler than the extinction method of sleep training. But according to Dr. Ferber in his best-selling book, How to Solve Your Child's Sleep Problems, it is still just as effective. He states in his book to allow your child to cry for a set amount of time before attempting to comfort them. So this takes the beginning of the extinction method, which includes a nighttime wind down routine, making sure all needs are met, placing them in a safe area, and leaving the room to allow them to attempt to comfort themselves. You go back in and check on your child in set periods of time. He states that to stay in the room for only 1 to 2 minutes, and then exit the room, coming back at another set period of time. He suggests 3, 5, 7, and then 10-minute intervals after that for going to check on the crying child. The goal is that eventually the child will learn that the caregiver is not going away and will always be back, but it is time for them to sleep. He states that this method can be performed up until the age of 2, but the older the child, the more difficult it will be, as seems to be the case with all methods of sleep training. Although there are many methods of sleep training, the Shush-Pat, the extinction, and the Ferber method stand out to me the most. I hope you've learned about these 3 methods, and if ever confronted with the task of sleep training an infant, will be able to recall this information.